Good afternoon, everybody, and welcome to our PCI talk. Today, we're joined by Eileen Hopkins, who is a psychotherapist and who also has a background in nursing and in life coaching. So I'm going to hand you over to Eileen to get a little bit of information around the frontline workers, the struggles that they're facing during this time, and to talk us through that side of the pandemic. So Eileen, you're very welcome.
Thanks a million, Jade, and thanks very much for inviting me to do this today. So my background, well, as you said, my background is nursing. Towards the latter part of my own nursing, I would have experienced burnout. I always said it was close to it, but I realised I probably had it. When I finished nursing and trained as a life coach, I started to do workshops for nurses and on self-care and resilience. I really saw that need that was there for people. I was nursing full-time until 2015. I'm not now. I went back briefly in the COVID, but I'm back to my thesis now.
Which brings about a whole different set of stress and struggles.
Absolutely.
So maybe we'll start with your experience of being a nurse and your understanding of nurses on the front line and what they might be going through during the crisis.
Okay, yeah, well, I nursed for over 30 years. The last about 15 years were in nurse management. I suppose I would have experienced the stresses of that, but never anything like what's happening now. When I was nursing, I suppose at that time, there wasn't a huge focus on nurses having stress, nurses being burnt out. It started to come to the fore towards the end of my nursing.
Okay.
And yeah, that's, so from the COVID part, I suppose I still have a lot of colleagues nursing.
Okay.
And talking to them, and I'm nursing abroad. So talking to them about it, about the stresses of it, the additional stresses, I suppose, the things that have stood out to me. The first was, well, obviously when you're having to wear PPE, you're shielded in a way, but you're also shielded from the humanness of the human interaction.
Yeah.
And for many nurses, there's not only the stress, there's the moral dilemma, because their values and their morals are hugely conflicted, because they want to sit with a patient who's upset, they want to hold their hand, they want to spend time with them, yet they're told if the patient has COVID, you have to be in and out of the room in 15 minutes. So as one nurse said to me, it's the get in and out time race, because so of course what was coming to my mind with that was like they're in a persistent state of fight or flight, because they're going in, they have these procedures to do, they have to get out, even if the patient is talking to them, even if they want to spend time with the patient, they have to get out.
Yeah.
And it's the pressure of that is it's immense, really,
And it almost goes against naturally what nurses would be doing in taking time, taking care, well, taking time where they can, of course, but kind of that humanness that nurses bring to their care of their patients, that's almost gone out the window, as you said.
It is. And like, I know, even I'm a smiler. I smile a lot. And, I might be, when I'm nursing, I might be with a patient, I mightn't even be what I'm saying, but it's the smile. And like 70% of our communication is nonverbal.
Yeah.
And like, that's gone. That's cut. And even for me, sometimes on a busy day, it'd be when a patient would smile or a patient would say something, but there's just a whole barrier there. Like it's.
And something else struck me about the PPE part of it, Eileen, through a personal experience I had this week. Unfortunately, a minor injury, but I ended up in the hospital with my daughter this week. For the time we were there, we had the disposable PPE, which we wouldn't have been used to wearing. And that's what the nurses and doctors were also wearing. And just the discomfort of the hot air, you know, being in that hospital environment. I couldn't wait to get the disposable mask off me when I left the hospital. You know, I think the cotton ones are a little bit more breathable, but I believe the PPE gear must be very, very uncomfortable, and
Very
those long hours.
And the thing is, it's you're taking it on and off so much. You go into a patient for 15 minutes, you come out, you have to take it all off. Then you're going into the next patient, you have to put in a new lot, like, because you're trying obviously not to spread things. But like, Irish hospitals aren't equipped for like air conditioning. Some of the newer ones would have a bit, but like a colleague of mine said, in the real warm weather, she put on the PPE over her scrubs. She said it was like having 20, 30 showers a day, because you were constantly wet with it, you know. And then she was also saying her face, with some of the goggles, her face was marked, her, you know, and wearing those masks, very, very uncomfortable.
So there's an additional physical sacrifice to the role of the frontline worker presently, due to even the clothes and the protective clothes that they have to wear, which makes the role different and more difficult.
Yeah, and more stressful.
So talk to me a little bit more about, okay, so that's one part of the physical effects that nurses and doctors are going through at the moment. What other effects might we be interested to hear that nurses are experiencing at the moment?
Well, I'll stick with physical for a moment, Jade, because the other physical thing, for anybody who's reading up and following on COVID, they've discovered that it's more effective in the treatment of COVID patients to nurse them prone. So they're lying on their tummy. Like, if you have a ventilated patient with a tube in, to turn them, normally when you're turning the patient, you use a hoist, you know, which is it helps you to, you know, so you're not doing the lifting. But even my brother over in Paris was saying, he said, when you're turning a patient onto their tummy, you have to lift, because it's the only way you can do it. Like, you have assistance, but you have to lift. So there's that part of it too, and the physicality of all that.
Of course, yeah.
You know.
And the long hours, then you're doing that.
Yeah, and of course the long hours. And then from a nurse's point or a frontline staff point, you have the worries then, the emotional part of it then. You know, firstly, you know, on your days off, you're concerned about anywhere you go that you could bring something into the hospital. So you're really, I know we're all been careful now, but they really, you know, trying hard not to bring something in. Then when you're in there, you're concerned about your family. You know, like, I know for a lot of my nursing colleagues who are married, who have children, they're sleeping in the spare room because they don't want to put their family at risk, but they don't want to bring anything in. And like, for some of them, especially in the earlier days of it, they were coming in the evening, stripping, showering, and not even cooking, because they were advised, and so somebody else was cooking. So, and limited contact at times with their children then too, because, and if they have older relatives, family, you know, the fear of spreading something to them and the pressure. And then when you bring that into the hospital, like 40% of the deaths were in hospitals, but 60% of them were in community-based settings in nursing homes. And I know we've all heard, but like, in some nursing homes, they lost over half their patients. Like, for these nurses who knew these patients, like in a hospital, sometimes you will have long-term patients, but a lot of the patients come and go. They may be in for a few weeks and out. In a nursing home or in a residential setting, these patients are like your family. You get to know them. You get to know their family. And, you know, so there's grief, there's loss for those staff. And also for them, there's the guilt and, did I bring it in? Was it my fault? Could I have done something different?
So a huge emotional toll on nurses, not to mention personal sacrifice.
Absolutely, yeah, absolutely.
So tell us a little bit more about that. What is the impact of all of these sacrifices and emotional strain on the emotional world of a frontline worker?
Well, I think at the moment they're still very much in fixing doing mode. And as a nurse, you're a fixer.
Yeah.
And my biggest challenge going into psychotherapy was to take this hat off, my fixing hat. And, but as nurses, we're fixers and we're doers. And so we're probably, for most nurses, they're still in that mode now. But my concern would be down the road, what it'll be like, and some of the research done on SARS said that initially after that event, some nurses were fine. Like, not every frontline staff is going to experience stress, burnout, post-traumatic stress was the other thing. But not every nurse will, but some will. But what they said was initially it started with a feeling of helplessness and vulnerability. And then it led on to depression and all that. So at the moment, I would say for most, they're doing okay. But I think it's going to be down the road. And I think the word trauma keeps coming round in my head, because I think this is absolute trauma, and the concern and the risk of post-traumatic stress for so many of these, I think it's huge.
And you mentioned already, Eileen, that the majority of nurses, they're doers, and everybody is in doing mode right now.
Yeah.
And as a result of sort of the stress responses and what they're responding to in the moment, they're very much, as you said, in fight or flight mode. Well, actually, they're in fight mode, aren't they? And we know that when you're in that fight mode long term, what that does to the autonomic nervous system. So you're absolutely right in terms of there could be a delayed stress response, trauma response to all of this. And I think it's really important that society knows that, and that our profession, psychotherapy and psychology profession, also know that. So,
yeah, and I think for psychotherapy, it's for us to, as psychotherapists, to get an understanding of where they're coming from and of the whole setup for them,
Exactly. So if you slip back into your psychotherapist hat for a moment, Eileen, what can psychotherapists do in preparation for the struggle that nurses and frontline workers are currently going through, and the potential long-term effects of the pandemic on the frontline workers?
Okay, well, this is when nurses come to them as clients. Is that what you're asking about there?
Yeah.
Well, I think the first thing is an understanding of the role, the complexity of what these people are experiencing, and what they're enduring, what they're experiencing, all the loss, all the death of colleagues. Like, it's not as if somebody's just going to come in with stress. There's going to be grief, complicated grief for many, loss, isolation, something that I mentioned to you before we started on the call. I spoke to a friend of mine who's a nurse, and I was trying to be really supportive with her. We were having a chat and we were walking, and I said to her, how is it in there? It must be really, really hard. And she said, Eileen, in there I'm okay. I'm supported. I have my colleagues. But she said, it's on my days off. She said, no one wants to see me. My family don't want me. She lives on her own. She said, my family don't want me to call down. A lot of my friends are avoiding, and not, like, they're all protecting themselves. But what's that like for, like, this friend in particular is an absolute doer, and on her days off she's go, go, go and meeting people, and she's none of that now. Like, the loss of that connection.
Yeah. It's monumentous, isn't it?
Yeah.
Yeah, and that's part of the sacrifice that you mentioned earlier on, and that we were speaking about earlier as well, that the sacrifice is huge. So that your friend and many other nurses and doctors, they're not only sacrificing their own health every time they step into the hospital, but they're sacrificing social interactions because of, the fears that people have at the moment around contamination and spreading and things like that.
Absolutely. And like on the question you asked me there, Jade, about what we as psychotherapists, Well, first of all, I actually believe that every nurse should have a therapist,
Okay.
especially at the moment. I don't think that's going to happen. You see, from the nursing end of it, I can see, like, I think it needs to be incorporated into their working day, that while they're in work, they have an hour when they see somebody. I think providing services on their days off, I don't think will work, because for many nurses, they're working 12, 13 hours, and on their days off, they're catching up, like all of us. So I think unless it's actually implemented in the work setting. But for us, sorry, I'm wandering a bit. I think for as therapists to understand the many facets of this COVID, for I keep referring to nurses, but it's frontline staff, carers, porters, doctors, like it's all, and listening. Can't underestimate it. To listen, to be there, to be a listening ear, to, I know for many nurses they'll be in the story, and I suppose it's to be aware they'll be in the story and to bring them out of the story and see what's going on behind the story. Because I know even for a lot of my friends, they get lost in the story.
Absolutely. And I think as well, a big part of that, Eileen, is something you mentioned in our own offline conversations, is around the stigma. And, maybe part of this conversation and something we can do as a profession is to give permission. And I say that, very respectfully, but to say it's okay to need a little bit of support. Actually, it's not just okay, it's expected that you'll need some support during or after this pandemic. So to help towards reducing stigma around seeking out support, because a lot of nurses, and I'm naming nurses, sorry, and I shouldn't be just isolated to nurses, but people, a lot of frontline workers, they're, as you said, they're doers, they're capable, they get on and they do what needs to be done. But also to break the stigma around that they may need some further support themselves too.
Absolutely, because I know even the time I was burnt out. For me, like, I went to therapy actually then, but I told nobody. Okay. I told nobody in work, and I remember the first time I told somebody I was going to therapy. It was after my interview for PCI. And I was asked at that interview, did I ever go to therapy? And I kind of, and I said, yes, I do. And I remember Mike, it was, saying to me, you'll be fine. So, and from that day on, with any of my friends or anything, before that I would have said I have a meeting, but now I'll say, I have my therapy today at 2, I'll meet you later or whatever. So it's even naming it, that it's there, but naming it that you're doing it, in the hope that, say if 2 nurses on the ward decide that they're going to avail of the supports, to name it to the others instead of having this secret that nobody knows.
Okay, that's important. Yeah. So with that in mind, okay, so we have an idea of, it's really important that as the professional psychotherapy have a clear understanding of the emotional impact, psychological, delayed trauma response potentially, and all of the other fringes that we talked about. It's important for us to have a clear understanding of that. And breaking stigma and even having conversations like this, that's all important from the profession side. But what can nurses themselves do, or frontline workers, should I say, what can they themselves do to support and mind themselves at the moment?
Well, I think the first thing is nurses are seen to be, well, I'm going to nurses now. Nurses are seen to be these superheroes.
Yeah.
Don't be a superhero. Absolutely don't be a superhero. Look after yourself. Look after your health, your physical health, your mental health. I think self-care is the big thing. And I know among a lot of my colleagues, the whole idea of self-care is, don't have time for that. But I think now more than ever, our self-care is vital. When you're off, to get a bit of exercise, go for a walk, and maybe, if you're at home, if you have children and a husband or a partner or whatever, it may be even to say, look, I'm going out on my own, put on your earphones, go out, listen to a bit of music and get a bit of time on your own. Even in that, it'll help you to process instead of maybe running away from stuff. Diet and eating. It's tough, but it's to eat a balanced diet, to get good nutritious meals, and maybe prepare on your day off and have some meals. It's something I did certainly over the last few years in nursing, and I would do now, is to prepare on my days off to have decent food. Sleep is massive. Like, we heal, we recover when we sleep. And I know, for some people, they're saying the difficulty sleeping with the long hours, to avoid, if possible, avoid self-medicating. The tendency to come home after a hard day, have a glass of wine, have a beer, have whatever. That's okay in moderation, but don't use it to push down and dampen the emotions and the feelings. To reach out to somebody. Not everybody will get what you're going through, but some people will. And maybe to identify 2 or 3 people, maybe even one person who's a support, whom you can chat to. Because I know with one of my friends, some of the things she told me that were happening, I couldn't repeat them. They were so heartbreaking. But at least she was able to talk about them. And I'm not saying I was great with it, but at least she was able to get it out and talk about it. Because if you're holding all that in, it's very, very hard, And I saw a quote, and I sent it to you. I think it was from a student nurse in Northern Ireland. And she said that we as nurses were perceived as superhuman. We're not. It's tough being out there, and we're human. And it's to remember that, because I know even as a nurse, on my days off, I was always the one called when there was any family health or family whatever. But to be there, if you have a family member who's a frontline worker, to give them that bit of support on their day off, to listen, to give them that, yeah.
Okay. That's really helpful. So what I hear there, Eileen, is there's a few key important things that nurses themselves can do, frontline workers themselves can do, and family members, to ease the pressure at this time and make things a little bit more manageable and palatable during this really, really pressured and tolling time. So one is sleep, paying attention to your own sleep, and try to do so naturally, maybe looking up some sleep hygiene tips. I know if you Google sleep hygiene, there's great resources online, so that might be very, very helpful. Getting a little bit of exercise, like kind of grounding yourself in nature, maybe going for a walk if you can as well. It's a great de-stressor, a way to process, switch off from the pressures of the world and just be with yourself. Eating well, that takes planning. It does, but that's important, isn't it? To give yourself fuel for those long days and to kind of combat some of the physical symptoms. And so some planning, that time well spent to plan good nutritious meals for yourself, and then not to hold back from reaching out for support. And then anybody who is a family member or a friend of a frontline worker who might be watching this talk, also to remember that the strongest of us might look like we're holding on and we're fine on our own, but do come forward and offer that listening ear or shoulder to cry on, because you never know who and when it might be.
Or it might be, even if they have children, to take the children for an hour, to give them a break, because I think now more than ever they need that.
Yeah, really practical, really good.
And the other thing what I should have mentioned in that, Jade, is to avail of the services that are being provided in work, because I know there are a lot of services and there are a lot of free services and resources there and supports, to avail of them.
Yeah.
Yeah. And it's not a weakness to do that.
That's really great insight from the lived experience of being a nurse. You volunteered your time, well, not volunteered, you chose to re-enter the nursing world during this time, which is so noble of yourself, Eileen, and looking at it from the psychotherapeutic lens as well. It's really, really insightful. And I suppose thank you for that, first of all. And then just really to say to all our frontline colleagues who are potentially watching along, that we see you and thank you.
And we care.
That's it, Eileen.
Yeah.
Okay. Thanks, everybody. And thank you, Eileen. Take care.
Thank you.